Good afternoon. Again, this is Judy Hackler, the Executive Director of the Virginia Assisted Living Association, and we're going to get started with today's webinar, VALA COVID discussion, Virginia's COVID response related to ALFs. We have a few housekeeping items to go over, and so we'll still welcome others into the webinar as they join us. As with any of our meetings, we have to follow the laws and regulations that are put out by the federal and the state government. And so we want to just put out a reminder for the antitrust requirements. And we want to make sure that no discussion or agreements or concerted actions may restrain competition, and that each participant is obligated to speak up for the purpose of this requirement. Some housekeeping and disclaimers. Please mute your line when not speaking. *6 can unmute telephone lines. Raise your hand if you would like to be unmuted by a host. You can also use the chat feature to also share questions and comments. This discussion is being recorded and will be shared on VALA's Health Alert webpage. The presentation slides will be shared online on the Health Alert webpage along with the clickable links, and those will be posted later this week as we have been continuously updating the information. Statements and information shared are a work in progress and may change. As with the COVID response, as we have developed best practices and tips, we are constantly updating the information, and so please know that some of the information may be in transition. I want to give a special thank you to our guest sponsor of today's webinar, Seniors Guide, and we do have Adam Brown with us just to share a little bit about Seniors Guide.
Hi, well, thank you so much. We are thrilled, as always, to be a proud supporter of VALA. We can't do it in person this year at the conference, so we will be doing it right here through the course of these webinars, hopefully. So a little bit about Seniors Guide for you guys that are not familiar with us. I'm the Regional Marketing Director. We cover the Midwest and the East Coast. Here we have 7 different markets. Primarily, we're a marketing service to the seniors industry. We have a fully searchable lead gen website for people who are looking for senior care. We have a publication. We have referral services. We also run networking groups. We have a wide range of different things, employment opportunities. We're really here for you. And honestly, during these times, we really have been doing our best to just reach out and help everybody in any which way we can. So if you all have any questions or anything, I can leave my information in the chat if you'd like to learn more about what we do. So anyway, thank you very much. I really appreciate the opportunity.
Thank you very much. We appreciate the partnership and the resources that your organization is able to provide to the providers and to the public.
Thank you. Appreciate it.
This webinar will be providing continuing education credits that are approved by NAB, and it will be up to 1.5 participant hours. Only those participants pre-registered for the webinar may be able to receive the CEUs, and only those that are participating on the live version of the webinar are also eligible for the CEUs. The CEUs will be uploaded to NAB for participants that have shared their NAB-R number with VALA. If you did not share that on your registration, then you may provide that to us after the webinar, and we can also upload that information after the fact. A few resources that will be available for clickable links on the shared slides once they become available on the VALA website is information of the VALA Health Alert webpage. So that's a good one to have because it links to all of these other resources. Also linked to the Virginia Long-Term Care Task Force webpage, the Virginia Department of Social Services, and the Centers for Disease Control and Prevention website, the General COVID page, which has additional links and resources. Special guest. We have guests from Jackson Lewis, PC, Argentum, the Virginia Department of Social Services, the Virginia Department of Health, the Virginia Department of Medical Assistance Services. So thank you all for joining us today. We truly appreciate it. We know that there are some time restrictions for some of the individuals participating on today's call, so some of them may be coming and going as their schedule permits. The preliminary discussion agenda, which of course may change based on schedule requirements. workplace standards, both the Virginia and US Department of Labor requirements, testing updates, reopening updates, personal protective equipment, infection prevention and control, and funding opportunities for assisted living communities. And then at the end, if there are additional COVID response items that you would like to discuss or have questions on, and some of that information we may be able to provide answers today, others will be glad to take and also to look at the research information in order to get back to you. For today's Department of Labor Workplace Safety Standards, we do have slides that are duplicative of the August 10th webinar. And so Courtney Malveaux has joined us again today in order to provide some of the highlights, as well as to provide information on some of the updates that have evolved since that presentation. The presentation slides will have these clickable links on them that you will be able to reference with regards to the workplace safety standards. And so now I will turn it over to Courtney to share information on these workplace safety standards.
Well, thank you, Judy, and thank you all for your time. And it was a pleasure to join you all in our last meeting, in which we talked at length about the new emergency temporary standard passed by the Department of Labor and Industry. So I'll speak to the OSHA, Occupational Safety and Health standard, and you see there we have quite a few other agenda items as well. So Judy, do we have, am I sharing my screen?
You can, if you would like to be able to go through, or we can do the screen on our side.
Oh, go on ahead, please, by all means. Thank you. So, yeah, so in deference to the many speakers that you have, I think I'll just highlight a few things if there are some points of confusion that have come up, and also some items that have been clarified since. So Judy, if we could go ahead and proceed through the next, say, 3 slides. And so I give a background on the standard, and it's this is a standard that applies in Virginia only. So it's not, some of you may be familiar with the general OSHA standards, and that's not what these are. This is really for Virginia employers only. Could you go ahead and advance for me? And so the ones that it applies to are probably everybody in this group. And so it's most private sector employers and all local and state employers as well. And so the only exceptions are essentially federal enclaves, or for contractors for the U.S. Postal Service or military bases. But apart from those smaller exceptions on the right column, the column to the left is really where this standard applies to. And it really does apply to nearly all private sector employees. Could you advance for me, please? And let's go, okay. So one thing just to mention, that it will expire at the end of January. And so there is a public comment period now that's open. And if you'd like to comment to the agency about a permanent standard, the agency's taken the temporary standard and it is now in consideration for a permanent standard by the end of January. And so there's a comment period now available if you'd like to click on the, it's right off the website for the agency, and you can click and you can add your comments if you wish to do so. So let's go ahead and proceed a couple more slides, please. And so the requirements for all employers, one thing that has really thrown a lot of people for a loop is that they say, well, am I a medium hazard employer or am I low hazard? And most people are finding that they're at least 2 out of the 4 categories. Most are, they have some administrative or desk jobs that may be low hazard. They may have some folks who are very interactive with other people who are medium. I think most or virtually all of your employees are going to be medium, whether you're dealing directly in terms of care or dealing in terms of people who come in and visit in your facility. So unless you have a true administrative position where you are just distanced from other people in your normal course of your duties, then that would be a low hazard job task. But I think by and large, a lot of the folks here in this group, you're going to fall under medium hazard. And medium hazard means if you're within 6 feet or more, 6 feet, if you're within 6 feet of somebody for 15 minutes or more, And that's generally what's used as the rule of thumb for minimal contact with others. So let's see, we don't, in terms of the sick leave policies, the General Assembly is looking at a number of items, and I'm not aware that it's going to make any moves in terms of sick leave. At this point, there is no required sick leave under Virginia law. So unless you're under FMLA, Family Medical Leave Act, or Families First Coronavirus Response Act, FFCRA, unless you fall within one of those or both of those, then there is not a requirement for sick leave for you. So now that could change. So just kind of be mindful of that. So there's an argument that, you know, two things. One, a lot of folks are wondering, do I have to offer paid sick leave? There's no requirement for paid sick leave in this standard whatsoever. It's only sick leave, and that could be paid if it's something that you in your judgment would wish to extend, and every employer is different in terms of its means. And then also there's confusion as to whether it requires sick leave, and really it cannot really require sick leave beyond what the General Assembly authorizes it to do. With that said, it is a very good idea, of course, in terms of best practice, to try to work with employees and extend sick leave and help people to recover or quarantine as necessary and get healthy and get back to work. Could we advance, please? So there's been a lot of questions about the reporting to Department of Health. And so since I last spoke, the State Department of Health has been pointing people over to the local departments of health. So people have been reporting there. And I strongly emphasize to you, if you can, definitely respond in writing and have by email or fax or something that you can date and have a time we know when it's been transmitted, so that we can demonstrate that you've been in compliance and reporting a positive COVID test within 24 hours. Excuse me. There have also been some questions about what I call the hotspot rule, which is reporting 3 or more cases at a work site. And so the agency has come out and clarified that it is 3 or more positive cases at a single work site. So if you have a work site in Roanoke and another in Northern Virginia and another one in Hampton Roads, and you have positive cases on all 3, then this rule doesn't kick in. So it's 3 or more employees in one work site. And if you have 3 or more within one work site, then within a 14-day window, then you have to report those positive cases to the Department of Labor and Industry. The department has used the link on its own website, so you actually don't have to phone or fax it in or email it. You can actually hit the link and you can plug in the information right off of the website for the Department of Labor and Industry. And then I strongly recommend getting a print screen or a screen save so that you can prove that you're in compliance in reporting 3 or more cases within a 24-hour period. So there's been also some questions in terms of anti-discrimination or anti-retaliation provisions. And so this is something that a lot of folks are trying to get their policies around and get their head around, which is that employees may go and report concerns about coronavirus at work, either on social media or to the news media. And so there are some adjustments in terms of, if you have a news media policy, if you have a social media policy for your employees, then you have to adjust for that. And so that's something that is now protected activity in Virginia. Could you advance for me, please? I'm just kind of hitting a few points here that are of question, and some other things might jump out at you as well. And I certainly entertain any questions that I can answer about topics that I'm not hitting, but I'm just trying to hit on those that seem to be the really hot questions that come my way over the last few weeks. And so when we look at low hazard, again, a lot of people are using the CDC rule, the 615 rule, within 6 feet of others for 15 minutes or less. And then if that's the case, and if that's what the job requires, then you're low hazard, even if it pops up on a list that says that, maybe your industry or your workplace is generally thought of as medium hazard, but this is really, you kind of look at the job tasks and you look at what people do and how they interact during the day. And that really is the driver in terms of what kind of hazard level people are dealing with. Could you advance for me, please? You also, and so let's get into the medium hazard. So you see that you have a lot of industries and workplaces that the agency in the standard calls medium hazard, but I'm really finding that, within a daycare after school care facility, or within a retail store, within a public transportation job place, that you really do have people of varying hazard levels within that place of employment. And so we don't have complete clarification on this, but I've been really counseling folks, look, if you have people who work over here and they're truly in a low hazard work site, and that's what their job hazard level is every day, then just train them to that. And then if you have people who are more medium hazard, and especially if you don't have people that are kind of cross-pollinating within the workplace and exposing each other, then just gearing the training toward the medium hazard folks, toward the hazards that they really encounter, then train them to that. A really big question is, okay, what's the training? For the lower hazard employers, there's a 2-pager. It's a flyer that has some basic information. You can either send it, you can give it orally, you can give it in writing. I've had employers who send it to their employees by an email or post it up on a bulletin board, and that's it. There's no real live training requirement. But for the medium hazard employers, they do have a much more thorough and training, and that's one that can be delivered in person, it can be delivered online, and however you see fit. Could you advance for me, please? So the medium hazard employers, if you do have medium hazard employees, then you're doing the infectious disease preparedness and response plan if you have over 10 employees. And so it includes all of these categories, all these subjects here on the right-hand side of the screen. And that's going to be due on September 25th. So that date's coming up quick. Could you advance for me, please? All right. So let's see. This kind of summarizes what the requirements are. I think a lot of you are becoming familiar with those, and you really are pulling those into your workplace plans. So just make sure that, there are a lot of questions in terms of, well, what if I have clients or children or students or whomever that come in and they're not wearing their face coverings? Then that, of course, increases risk. And so, we have to do what we can do to try to encourage safety. A lot of the standard is written such that it leaves it in the discretion of the employer to address hazards as they encounter them. So that's really why we still have to remain mindful of the CDC guidance, and especially when it comes to the face masks. So what you're using is important. The cloth face covering is now thought to be the gold standard. The neck gaiters seem to be effective. I used to have the bandana that is frowned upon. The face shields are frowned upon just because they're not protecting you people in groups in terms of what they expel out toward others. So none of this is PPE. It's not personal protective equipment because it's not protecting me. It's just protecting others from what I may spread out to others. And so that's really the crux of the face covering. So kind of staying on top of how you're addressing the hazard is important. So back to my point about if I have children or if I have people maybe who are not going to put on a face piece, then how do you account for that? And so really, they're saying, look, just to the extent that you can encourage that, certainly have that for yourselves, and then really try to build in, if you can, I know the engineering controls and the plexiglass doesn't necessarily work when you're in a very interactive environment, but to the extent that you have the hand sanitizer, hand washing stations, consistent disinfection, and to the extent that you can work in ways to control spread. That's really what the agency is going for. And it's going to be very case by case. Could you advance, please? Okay, so then there's the training, and the training deadline actually did pass last week. So if you haven't done your training, don't panic, but know that if you're medium hazard or higher, that this is something you need to do. And as far as I know, the agency isn't necessarily going out and going workplace to track down people who didn't make their training deadline, but it's something that you really should have in place. And I'm glad to help you with yours. There's the training documents on the agency website are kind of comprehensive. So it could be a 40-page document, whereas for your workplace, you might get it down to 20. And so as long as you're including the right elements, you're addressing the hazards in your workplace, you're doing fine. But if you haven't gotten started, then this is a great time to do so. Let's advance, please. Oh, and then I include my slides for high hazard. And with that, I'm glad to take any questions if I can.
Remember that if you have any questions, you can use *6 if you're on the telephone. You can use your chat function if you're on the computer, and you can also mark it to raise your hand so that we will unmute your line. If you think of questions after today's presentation, then you may also email it to Courtney. His email is on the screen for those of you that are participating by the computer. You may also email them to us at VALA, and our information will be at the end of the presentation, as well as it was on your registration email. So, any questions? Well, thank you, Courtney, for sharing that information. We truly appreciate it, and we will definitely be monitoring this and trying to make sure we get updated information out as it is evolved.
Thank you. Anything I can do to help?
Thank you. Next on our presentation for today, we would like to cover some U.S. Department of Labor information. And with that, we have invited our national affiliate from Argentum, and we have Dan Sampson, who is joining us from Argentum, to join us.
Great, thank you, Judy. Again, I'm Dan Sampson. I'm the Director of Government Relations at Argentum, which is the national association representing the senior living industry. So within Argentum, we're responsible with leading the association's public policy efforts at the federal level and assisting with any efforts at the state level, including through our partnership with VALA. So thank you for inviting me to be on this presentation, talk a little bit about the challenge to the CARES Act paid leave rules. So just to quickly recap, if we can go back in time to March, and again, tomorrow's going to be September, it's hard to even tell time at this point, but if we can go back in time to March, there were 3 bills that were addressing the pandemic that were quickly signed into law in March. 2 of them provided for federal expanded paid leave. One of them was the Families First and Coronavirus Response Act. That's more commonly known as Families First, and that was the bill that established the bulk of the paid leave provisions. And the other was the massive $2 trillion CARES Act. And this bill made some technical corrections to the paid leave provisions. So the laws included both the Emergency Family and Medical Leave Expansion Act, or Emergency FMLA, and the Emergency Paid Sick Leave Act. Both are generally applicable only to employers with fewer than 500 employees. The expanded FMLA, it provides up to 3 months of leave for employees who are unable to work due to COVID. And this is for a wide variety of reasons. This could be a worker who is diagnosed with COVID. This could be for a worker who is quarantined by their employer, by a healthcare official, or by some government in an effort to prevent the spread of COVID. It could be for a worker caring for another person diagnosed with COVID or quarantined due to COVID. Or critically, it can also be for a worker caring for a child or an adult unable to care for themselves following the closure of a school or care facility due to COVID. And importantly, this includes if the facility is only physically closed, but it's still offering some sort of virtual education. So we're obviously seeing a lot of schools that are moving into an entirely virtual environment, based on the interpretation of this law and the rule, is that if the school is physically closed but offering virtual education, then this would be applicable. So the second half of the paid leave is related to the emergency paid sick leave, and that requires employers to provide employees with up to 2 weeks of paid sick leave for certain qualifying reasons. So just once again, I want to reiterate that these are only applicable to employers with fewer than 500 employees, and there's also a few carve-outs for employers with fewer than 50 employees, but that's a little bit more technical in nature. But the bulk of this is, again, only for employers with fewer than 500 employees. Any employer with more than 500 or more employees, all these paid leave provisions do not apply. The laws were specifically written with exemptions included and instructions for the Department of Labor to flesh out how these exemptions worked. Specifically, any employee who is a healthcare provider or an emergency responder may be excluded from being eligible for leave. Now, we quickly recognized the impact that these paid leave provisions could have on the senior living workforce, especially the school closure component. And because of that, we had requested the Department of Labor in its rulemaking to recognize senior living as being excluded from the paid leave provisions. And we did receive some good news at first in April when the DOL issued a regulation to exempt healthcare providers from being required to offer these paid leave provisions. And this is a very broad exemption to the law. It included, based on their definition, all senior living employees, both direct care staff and support staff, just as how we had requested it. Earlier this month, if you want to go to the next slide, please. Earlier this month, a federal court in New York had issued a ruling that overturns the DOL exemption to the regulation for healthcare providers, and it would revert to a much more narrow definition that would mostly just be medical doctors, and it would not include nurses and personal care aides and any of the support staff. And again, I just want to reiterate that the court only struck down the exemption for healthcare providers, not the full rule, and it did not do anything with the exemption for emergency responders. So that brings us to where we are today, and the DOL is currently considering its options on how it can proceed. It can appeal the ruling, it can issue a new interim rule. We have written to the Department of Labor to ask for both an appeal as well as an interim rule that would broaden the definition to include all senior living workers to be deemed as essential to the operation of communities, and that would include both the direct care staff and support staff. And along with our letter to the Department of Labor, we'd included a enumerated list of positions, again, both direct care and support staff, to be excluded from the paid leave rules under expanded FMLA and the expanded paid leave. It's still a little bit unclear whether this ruling applies to just New York or if it applies nationally, but more than likely, we believe that the ruling is national in scope and all providers should be following the new rule, again, which strips away those exemptions for healthcare providers. We are continuing to get a little bit more clarity on how this would work, and the next steps we're sort of looking for from the Trump administration. But again, just to recap for you all, for due diligence, you should treat the healthcare provider exemption of the rule as though it has been stricken nationwide, including in Virginia, and otherwise the rest of the rulemaking stands as is. And again, just going back to how the rule was crafted to begin with, I just want to reiterate that it's despite the broad scope of the exemption that was included in the rule, the practical impact of striking this exemption may be relatively small. And I know that's relatively speaking, depending on how many employees you have. But again, the leave provisions are only applicable to employers with with fewer than 500 employees. So we're continuing to monitor how this is going to be playing out and how this may change, and we're continuing to advocate on behalf of senior living providers so they will continue to be excluded from these paid leave provisions so that we can ensure that seniors are able to continue receiving the care that they are depending on, that caregivers are still remaining on the job and available to be caring for seniors again who are, as you all know, the most vulnerable to COVID. So that's just a quick rundown of where we are with the challenge to the expanded paid leave provisions. I'm happy to address any questions you have right now. Otherwise, if you want to email me directly, or if you want to email VALA, you can certainly do that, and I can get back to you from there. But just quickly, here's a chart that helps to simplify how the paid leave and expanded paid leave provisions would apply, so you can get an understanding of, again, the rate of pay, the maximum benefit, and how long an employee would be eligible to be out. And as we have more information on how this challenge to the rule is handled, we will provide that to VALA, and again, happy to answer any questions you have right now.
Thank you, Dan, for that information. Truly appreciate it. Anybody have questions on the federal paid leave exemption for Dan? If not, as he mentioned, you're welcome to send questions after today's webinar to me, and we can also consult with our Gentum in regards to what the exemptions might mean, also with what the interpretations are going to be from the courts and how the Department of Labor is interpreting the information and putting out the requirements. We will continue to monitor this information and put out updates as provided to us. I do see a question in one of the chats. Are we or are we not exempt as senior living providers?
So based on the ruling, and again, this is for the exemption for the rules that apply to employers with fewer than 500 employees. The ruling stands that, and we again believe this applies nationwide, that the exemption for your workers is no longer in place, and you should refer back to existing FMLA standards. We believe that the department will be challenging or appealing the ruling, and at that point we may have a stay in the definition, and this is getting a lot more legal and technical than we may need to get into at this point. But at this point, you should only be referring to the FMLA standards as they existed before COVID. So a healthcare provider is only defined as truly a medical doctor, and not anybody else. That we had expanded the definition much more broadly to include, nurses and personal care aides and everybody else who works in a senior living community.
And this information is information that we have viewed online that is publicly available. As mentioned before, links will be on the document that's going to be shared in the follow-up slides. But if you have questions about your specific community, please do feel free to reach out to attorneys so that they can review your specific situations in order to determine how you need to be complying with whatever regulations, whether it's a state regulation or federal regulation, to make sure that you are in compliance. And I do see a chat about the website reference says that it's only in New York right now. That is accurate as far as that particular contestation, that it was the New York Attorney General's that did argue that the interpretation for healthcare provider was not sufficient, and so it could be copycatted to other states, and so that's something that our Gentum and we as the state associations are also monitoring, and so that's one reason why they're saying to be sure to double check with where you're complying, because the requirements could shift based on what the result of the lawsuit is going to be. Any other questions or comments? One comment I do see that's coming across is, it's an exclamation of wow. This could be detrimental to smaller care providers if much of the staff decides to use this. How would smaller providers afford to pay both the employees who are due to FFCRA and a replacement employee? So that is definitely a dilemma that is being considered. And Dan, I don't know if you want to speak on that about the impact to smaller providers.
Sure. No, that's an excellent point. And there's sort of 2 points to go off of that. One, the costs are actually reimbursable by tax credits that cover 100% of the cost of the benefit. But we're not as concerned about the cost impact to employers as we are about the actual workforce and the ability to provide care. And that's why we are making such a push to the Department of Labor to appeal the ruling and to issue an interim ruling or an interim rule that would expand the definition and recognize that beyond just senior living workers, that the healthcare industry as a whole needs to have workers addressing the COVID pandemic now, and with the again broad laws that established for any school closure that parents could take time off based on the expanded paid leave, that could really decimate the workforce all around in the healthcare industry. And we're specifically arguing with regards to the senior living industry, and very well for smaller employers, this could be really detrimental to the workforce, and we're really raising that as a concern as this continues to play out.
We do have one more question before we move on to our next topic. How would a nonprofit have their costs reimbursed by tax credits?
I would have to look into the specifics of that. So if you can share that information with me, I will get back to the questioner.
Will do. Thank you. All right. Thank you, Dan, for this information. It will definitely be a to be continued topic, and so we'll look forward to bringing additional updates on this on future webinars. Moving on to our next topic for today. We want to talk about testing for COVID and other elements. And so we have testing updates that are being provided to us by the Department of Health. And so the first topic is with regards to CLIA requirements. So I welcome Kim Beasley to join the conversation on this.
Hi, just confirming that you can hear me.
Yes, we can hear you.
Okay, great. Good afternoon, and thanks for having me. Just wanted to provide a general overview of CLIA, what that means, and how it may affect assisted living facilities if they have interest in providing COVID testing. So CLIA stands for Clinical Laboratory Improvement Amendments. They are federal regulations that apply to pretty much any type of facility or business that provides laboratory testing. Doesn't necessarily have to be a medical facility. Again, it could apply to pretty much any type of facility that's offering lab testing. Very few exceptions to this. Some of the exceptions would be if the testing is for research purposes only, or if it's for pre-employment reasons. Those are some of the exceptions. Virginia does not have any state regulations when it comes to laboratories, so we just refer to the federal CLIA regulations. The testing is set up into different categories depending on the complexity of the testing. And things that go into consideration for testing complexity are the type of specimen that's used, specimen processing requirements, whether there's automation involved, whether it's basically a full manual type test. So I think for purposes of this call today, most of you all would be interested in testing that falls into the waived category. And just to kind of offer a little bit of explanation about waived, because I think sometimes there's some confusion with that term. It is a category of testing complexity under CLIA. It does not mean that that it is waived from the requirements, so it's not an exemption. It just happens to be one of the names of the complexity categories. So again, anyone who performs or is wishing to perform CLIA testing has to complete an application, which is online. And the certificate of waiver is good once issued. It is good for 2 years, and the cost is $150. And again, that's every 2 years. Our office is prioritizing any applications that we receive right now related to COVID testing. And one of the things, if you're interested in performing the testing, I would just urge you to make sure that the test that you select to perform does fall within the waived category. Our office is receiving a fair number of complaints about facilities, and I don't mean this as assisted living facilities, but just in general. We're receiving a fair number of complaints about facilities in the state that are performing COVID testing under a certificate of waiver that is actually categorized at a higher level complexity. So you want to just make sure that the test you select is one of the ones that is approved as CLIA waived. One of the other things that just happened recently, in fact last week, is that CMS has now issued reporting requirements to laboratories. And if you hold a CLIA certificate, according to CMS, for all purposes, you're now considered a laboratory. So I just want to bring this to the forefront because this is a new requirement, again, just came out last week about reporting testing results to the CDC, the NHSN website, similar to what is being required of nursing homes. And in addition to that, you also have to comply with the state VDH requirements for reporting testing, of course, on the state level. So I'll stop right there. I know that's a lot of information, but just wanted to provide a general overview and happy to take any questions related to CLIA.
Thank you for that overview. On the screen, for those that are on the call, we do have links to the CDC website, the CMS website, and the Virginia Department of Health website with regards to CLIA, and so it has additional contact information on those websites. So when we send the slides out, the people on the phone will also be able to have that information to learn more about CLIA should they be wishing to have their communities do the testing. Any questions with regards to CLIA? All right, thank you, Kim, for that. We do want to also provide just some generalized information because there's lots of tests that are currently out there specifically regarding COVID-19 testing. And so I don't know if Kim or Kathy Peterson with DSS is available to speak on any of these items. I know Kathy was going to join us. She may not be with us just yet due to scheduling, but we just wanted to let you know that there are different tests out there. There's two different main types of diagnostic test as well as serology or antibody test. The diagnostic test, you have the PCR-based test and the antigen test, and information on each of these testing types is available on the Department of Health's COVID-19 testing websites. And so on the slides, we've got some links that go directly to those, and it talks about some of the efficacy of those tests and when they should be used, when they shouldn't be used, There's also a link to CDC guidance on interpreting the COVID-19 test result. And so that information is linked on the screen, and it will be a clickable link that you can also reference. I do see a question reverting back to CLIA. So Kim, the question is, how long does it take to get the CLIA certificate?
Okay, so for the CLIA application, we do require a hard copy with original signature application, so that would have to be mailed in to our office, the application itself. Again, we are prioritizing any applications related to COVID-19 testing. We are processing, routine applications quickly as well. Once we enter the information into the CLIA database, it immediately assigns your CLIA identification number at that point. You are ready to start testing at that moment. So what a lot of people will do if this is, for instance, a certificate, an application for COVID testing, they will follow back up with us to find out, once we've processed the application, to go ahead and get that CLIA ID number from us to go ahead and start the testing. But what happens after the system assigns your ID number is then it will also generate an invoice for that $150. And that comes through the mail, so you will receive an invoice in the mail. You can either mail a payment back in, or you can go online and make your payment. Once the payment is posted, then CMS will mail out your CLIA certificate to you. So again, depending on if you pay online, so forth, there's it can be a matter of weeks before you actually get that certificate in hand. But again, as soon as we process the application, you are good to start testing at that time.
Very good, thank you. Any other questions?
Judy, this is Lee Burke. Kathy Peterson is on the line, but she said you can't hear her. So I don't know.
I'm not sure what number is hers in order to unmute her. So *6, Kathy, if you're able to do that to unmute.
Well, if she can't unmute, I will tell you that we are getting ready to set up a meeting with VDH to talk about testing in ALFs and resources for ALFs and testing supplies and things like that. Hopefully we'll be able to have some kind of meeting like this towards the end of this week or perhaps next week to try and put more information together to get out to the ALFs regarding testing.
Very good, thank you. We'll look forward to getting those updates. And all right, so we're going to continue to also work on trying to get Kathy involved in order to allow her to share some updates, but we're going to move on to be respectful of time. The next on our presentation, we have the Department of Social Services providing updates on reopening as well as some other items. So we welcome the Department of Social Services for these updates.
Okay, well, this is Lee Burke again. Happy Monday, everybody. I just wanted to go over a few things that we've been working on. So over the past 2 weeks, we've recently issued a number of memos for assisted living facilities, the CARES Act funding for assisted living providers, personal protective equipment distribution update, influenza vaccination memo, a hurricane season memo, and as of today, we sent out point prevalence surveys in assisted living facilities for those facilities that have not yet had their PPS done and wanted more information on that process before, during, and after. So if you didn't receive any of those memos, please go to the link that Judy provided earlier today so that you can get that information. We are trying to provide as as much updated information as we can as we all proceed through this. And if you're not getting them, please reach out to your licensing inspector so we make sure we have the correct email address as well, because we want you to get this information as we send it out. Okay, on the next slide, real briefly, can someone, oh, there you go, thank you. We have written updated reopening recommendations for assisted living facilities. This document is comparable to the reopening guidelines that VDH issued for nursing homes. It does have a lot of the same content. It is currently under review by VDH. And as soon as that document is finalized, we'll send that out to you. I know some facilities still have concerns about how to do the three-phased approach, or even if it's possible, depending on the size and level of care of their facilities. So hopefully this document will be finalized soon and we'll get that right out to you. And there are some more tips and best practices under development that we're working on. We're working on getting these completed as quickly as we can. Mental health needs of residents, mental health needs of staff, cognitive impairment in COVID-19, return to work after COVID. And if there are any other topics that you all would like us to put one of those one-page documents together for tips and best practices, please reach out to myself, Kathy Peterson, anyone in licensing that you know, because they will get us that information and we will add that to the list of content to be able to provide to you all. We just have a few reminders. As we interact with providers, we've come across numerous situations where infection control plans haven't been updated to reflect COVID. So we're reminding everyone to make sure that you are updating your infection control plan, as well as reviewing your emergency preparedness and response plan. It is hurricane season. Facilities may lose power. There may be a need to evacuate. If that's the case, you need to keep COVID in mind if that should occur. And how will your emergency preparedness and response plan differ than now based on COVID than it did prior to pre-COVID? If you need, again, any questions or help with that, please feel free to reach out with someone in licensing. We're more than happy to help you with that. Also, another reminder is that, you know, we're all in this together, VDH, DSS, we're all here to help you. We realize that this is a very, very difficult time. Some of the local health departments have reached out to the various regions within DSS to express concern that they were having difficulty gaining access to facilities with outbreaks, or even with one case. And the whole purpose for the local health department is just to come in and help assess what you're currently doing and to provide you feedback to help make things better, to try and reduce or prevent a spread of COVID in your building. So by all means, please utilize that resource because they are there to help you. And another thing to discuss is, you know, we have asked everyone to put their mitigation plan in place. We had sent out a template for that discusses how you would, numerous things, including how you would handle if you did have residents or staff members that have tested positive for COVID. One of the things that we have learned through this process is that some plans are to send their symptomatic residents to the hospital and not allow their return until they are either retested or have stayed somewhere else for 14 days. A few of the hospital systems have expressed concern regarding that plan because it is putting hospitals in a position to keep residents in a hospital that don't qualify for hospital admission. So if at all possible, you are able to accept these residents back into their home while they do their quarantine period or receive their care, that would really be the best option. We don't want any resident to not be in their home. If you have concerns about how to protect your other residents, again, reach out to us or the health department. Any of us will be more than happy to help guide you through that process. Okay, next slide, please.
We did get reconnected with Kathy as well on the line.
That's perfect because this next slide is hers. So I'll
Hey.
turn it over to her.
Just confirming you can hear me now.
We can. Welcome back.
Very good. I'm so sorry for the technical difficulties. Just wanted to go over point prevalence surveys and fit testing in assisted living facilities. We have been working diligently with the Virginia Department of Health to arrange for PPS in assisted living facilities. We are sitting at about 100 or so assisted living facilities that have not voiced interest in having PPS done in their facilities. So while this is not mandated, we are strongly encouraging all facilities to have PPS completed through VDH and VANG, the Virginia Air National Guard. And if you are interested and you have after reviewing the information that we've sent out today, we did send out a memo in a one-page document just going over what PPS is and what to expect. Please make sure that you take a look at that. If you are interested, there is an email address that is included that you can contact Virginia Department of Health and get on the list to get scheduled to have this done. It is free of charge, and it is for staff and residents. So we really, as I said, strongly encourage you to take advantage of this and have this done for your facility. We're also working with the Virginia Department of Health, and I know that they may speak with us on this regarding fit testing. This is something else that we are strongly encouraging all facilities to take advantage of the free Train the Trainer sessions put forth by Virginia Department of Health. They have worked very hard in the last couple of months to ensure that all facilities have someone in their facility that can provide the fit testing for all of their staff and have a Train the Trainer, have someone there that can train other folks to do that in their facilities. So they are, I believe they're winding down this week, but there is a link on the fit testing informational page on VDH's website that if you are interested and were not able to make one of the sessions, that you can voice your interest, and they are have an ongoing schedule until we can really see a big dent put in the number of facilities that have been fit tested. On that note, yes.
We do have a question that's been presented in the chat on what is available for retesting. It's now been 2 months since we did our PPS. Our antigen testing has been delayed by the nursing home order by the government. Worried that we're not able to do the serial testing. Can you recommend and provide contacts to any private labs that we could contract with to allow us to do on-site testing of staff and residents and/or follow-up testing as needed following antigen testing?
Yes, we will provide that information. I know that VDH has that information as well. We will provide that information on our website. What we are really pushing for now is just the baseline testing. So if you've already had the baseline testing done, as you mentioned, it would need to go through a private lab. We will be providing information on our website and sending that out to you all regarding, labs that have been vetted and can provide that follow-up testing. Okay. Moving along to the kind of dovetailing on fit testing, all licensing offices do have fit test kits to loan. So if you have participated in a training session and would like to have your facility fit, your staff in your facility fit tested, all of our regional licensing offices do have kits that we can loan out to you. We will be providing information to all of our inspectors and all of our regional offices with sign-up information that you can have a loaner kit to get your facility fit tested. Okay. I also want to share some exciting news. VDSS has recently had a meeting last week with the Virginia Healthcare Association, Hospital and Healthcare Association, and we will be joining VHAS. We are in the planning stages now to have all of the assisted living facilities in Virginia to report through VHAS. We strongly feel that this will eliminate duplicative reporting, and which we have heard a lot of feedback from, that there's a lot of duplicative reporting. They have to report burn rate and inventory with us, and then they're having to report it elsewhere. We have, as I said, started the process to get assisted living facilities on board with this. We are hoping that within the next couple of months we will be up and running. We are encouraging all facilities to go ahead and register with VHAS now, and go ahead and kind of get your facility in there, get all your information in there, so that when this is up and running and we do the initial push, that you'll be ready to go. Okay. Any questions? Wonderful. I thank you guys for having us today. And if there's any questions, please feel free to reach out to us and we'll help you as best we can.
Thank you very much for that. We appreciate it, and we look forward to the partnership of having VDSS included in the VHAS reporting efforts. Next on our agenda, we have an update from Christy Gray with the Virginia Department of Health.
Good afternoon. Can you hear me?
Yes, we can.
Excellent. Okay, I'm just navigating back to the Zoom call. Okay, excellent. I can see the presentation. Thank you so much for having me this afternoon. I just wanted to give you an update on vaccination planning in Virginia, the first of which is influenza. So this year, I know I've spoken before, but influenza vaccination is very important every year to help reduce the amount of transmission of the virus circulating in communities, and it can help reduce severity of illness even if you are exposed and develop symptoms and are ill. It has been proven to reduce severity and death according to influenza. And this year will be even more important because influenza and SARS-CoV-2 will be circulating, these viruses be circulating at the same time. And influenza is one that we have access to a vaccine and has been proven to be helpful. So we do want to push facilities to be thinking through now, how are your residents and staff going to be vaccinated against flu? Is it going to be internally? Do you vaccinate your own residents and staff? Do you encourage they go outside the facility? Do you provide vouchers? Do you just encourage them to go out? Do you bring in a contractor to do it? So think through how you're going to do it this year, because this year, as we have seen in other situations, has presented its own problems due to the pandemic, with requirements of social distancing and PPE, other considerations we have not had to use in or take in prior influenza years. So definitely be thinking this through now. I know you have a lot on your plate. You're already considering much. However, this is something that will help pay off in the flu season right around the corner. We're entering September this week. Definitely have your plan and start implementing it. One thing I always like to point out, especially with staff, if you're used to dropping by a pharmacy on your way home to get vaccinated, or you're used to getting it somewhere, it might not be the case this year. So definitely be considering for your staff and for your residents, how are they going to get vaccinated, knowing what we have to consider this year. We do recommend our Healthy People 2020 goal for healthcare worker influenza coverage rate is 90%. Previous national surveys has shown that Virginia is able to reach that, so we definitely want to aim for that this year. Again, I like this phrase, take flu off the table, because COVID-19 and flu have very similar symptoms, and it might be difficult to distinguish them, especially at first, without being tested. So if you can prevent one of those viruses from causing you symptoms, you can reduce the amount of people that you have to consider, whether this is flu or COVID. So let's take flu off the table. And then take the time now to enroll and onboard in the Virginia Immunization Information System, or VIS. And the reason for that is things are just going to become more hectic. If you are not already onboarded with the state immunization registry, please do it now. You will not have time to do it later when you need to if you want to vaccinate for COVID-19 vaccine. Next slide. And so I just want to go a little bit further into this. So the purpose of this is to create one definitive and accurate consolidated record from multiple providers or entities in Virginia. So we have contributions from vital records, from healthcare providers, hospitals, emergency rooms, pharmacies, etc., into one record that a person can have to have all their immunizations in one location, and the provider who is treating them can know which vaccines they've received and when. So that can help prevent under and over immunization for the patient, and as a population, that is good to ensure that vaccine preventable diseases are held at bay and we are not wasting dollars towards over-vaccinating a population. There is no cost associated with maintaining a record in VIS or accessing it. Access is restricted to authorized users, and access training and customer support is free. If you have an electronic health record system for your facility, you can connect the system to VIS. There may be costs associated with connecting the system to VIS from the EHR perspective. Many offices have integrated VIS into their day-to-day operations without disruption. It is always hard to do this, any kind of change at first, but we have many people, many entities, organizations who have said they can't believe how they operated before using VIS. There is a link embedded in this PowerPoint that is a training video that you can see firsthand what it's like to navigate throughout the system to look up a patient. And you can see that on your own time. If you would like to pursue onboarding, please contact us. There's an email address here that you can reach out. We'll set you up with your, we have 5 regional trainers that work with all healthcare providers in their region. We're happy to get you connected today. Next slide. Okay, and just wanted to touch base on what we know about COVID-19 vaccine today. I say today because we learn things sometimes new every day about this changing and complex landscape that is the COVID-19 vaccine. We anticipate at least 2 phases of getting vaccine out to the public. A third phase is likely to be more of a routine vaccination of COVID-19 vaccine, or vaccinating those who weren't vaccinated the prior 2 phases. We would hope most of the population does get vaccinated. It's still, the data will still show whether that phase is necessary. But the initial phase of COVID-19 vaccine, there will be limited vaccine, and it will be provided to identified priority groups in closed clinic settings. The vaccines that are going to be available in the first phase are likely to be 1 to 2 different types of vaccines. And then as the second phase opens up to the general population, we could have as much as 5 to 7 different types of vaccine. So that's several different types of vaccine to have to manage and understand the difference of how to handle them. There's different dosing requirements, and some will require 2 doses to complete a series. There's different storage and handling requirements. Some vaccines will require refrigeration, some will require freezer storage, and some will require ultra cold storage. The administration and the mixing of the vaccines will be different. And if you do have a vaccine that has 2 doses, they are not interchangeable. So if you start with one type of vaccine, you have to finish your series with the other. We expect varying efficacy and adverse event profile population. Depending on the different populations, a vaccine might work well in an older population or a younger population, or vice versa. We expect there's going to be central distribution of vaccine, with the exception of some direct ship to the provider's offices. We do expect that there's going to be priority groups in the initial phase because of the limited vaccine that will be available. We are considering that those priority groups might be healthcare workers, early responders, essential workers, high-risk populations. The Federal CDC Advisory Committee on Immunization Practices and the National Academy of Science are considering these different priority groups based off of who is likely to be most exposed to the disease, and those who are most likely to have the most severe effects after being exposed. And so these 2 considerations are being discussed, and we'll be providing recommendations on what priority groups should be identified in the initial phase. There's also going to be a requirement of near real-time reporting of vaccine administration, which means we will be using the Virginia Immunization Information System as well as the CDC module called VAMS to be able to do that. We do recognize that communication and education about COVID-19 vaccine will be crucial to maintain the trust of the public, especially those who have developed distrust of the public health and government for good reason. We want to ensure there's transparency of what we know about the vaccine, the risks, the benefits, and make sure that we are being clear and transparent about all that is involved. So that brings me to considering how your facility can plan for this next stage. I know you have a lot on your plate right now with everything that's been discussed so far, and this is a little further off in the distance than I'm sure all the fires you're putting off now, but it will be here sooner than we think. And it's important to plan for it now so that you're ready to act when the vaccine is available, because the vaccine has had a different manufacturing process or timeline than is usual for vaccines. Typically, you complete third stage trials before you even start manufacturing the vaccine. However, the federal government has started manufacturing these vaccines while these trials are going on, so that if the data shows the vaccine are safe and effective, they can ship them out on day one of reviewing that data and ASAP recommending the vaccine. So therefore, there won't be as much of a lag as we might be useful between the advisory committee recommending a vaccine and when the vaccine will be available. Therefore, we recommend that you be making these plans now. Similar to influenza vaccine, consider how do you plan on vaccinating your staff and your residents. Are you going to want the vaccine shipped directly to your facility and you do all the vaccination? Do you want to bring in a contractor? Or would you request some of your staff or residents are getting vaccinated outside of your facility? Knowing all that information, thinking through it now, will help you identify how you're going to do this in the coming months. VDH is creating a COVID-19 vaccine. It says registration here, but it's actually going to be titled a provider intent form. And that is because we're asking any healthcare provider of their intent to vaccinate COVID-19 vaccine to register that intent with VDH, so we know what the demand is. We know what your patient population is. Do you plan on vaccinating your staff? How much of that? So we know that when we're looking at getting vaccine out to providers, we have that information already completed for you. We know your shipping information and your hours and days that you can receive vaccine. All that information will have been done beforehand so that we can hit the ground running when the vaccine is available. So please be on the lookout for that. We're hoping to get that intent form out in the next few weeks, and happy to provide that through Judy or the multiple other means we plan to get that out. I'm going to put in another plug for VIS at the bottom of the slide. Please reach out, please register and on board with us, because that will be necessary. Do it now so that we can get that step out of the way. I'm happy to answer any questions.
Thank you very much for that update. We will definitely be watching that as well, so lots on our to-do list. Any questions or comments with regards to the flu vaccination preparations or information on the COVID vaccine? I do see a hand raised, and so Amy Feather, you are unmuted.
Okay. Thanks, Judy. Can you hear me?
I can hear you.
Thanks. Hey, when we are trying to register for the VIIS, assisted living, we don't have like a medical type license. So what kind of...
An MPI?
Yes. They're asking, or they've asked for a medical license number, and because we're assisted living, we don't operate that way, even though we might be giving vaccinations.
You have nobody on staff that has an MPI number?
No, we are not, like, we don't bill Medicare and things like that. And although we have a medical director, most assisted livings that I know of do not have a medical director, nor do they have an NPI number that's even associated unless they use one of their physicians. But if the physician isn't the one giving the vaccination, I don't know that they would want the community to use it.
Okay, it doesn't have to be a medical doctor MPI number. But you know, let me get into that, and I can get back with Judy.
Yeah, because those are, an NPI is what you would use if you were going to be billing to Medicare. And assisted living doesn't bill to Medicare like a skilled nursing does.
I do see a comment also from another provider about no NPI number available for us. We do not have a medical director. And then another comment, we don't have an NPI number also. So it sounds like this is definitely something we can go back to and get an update and then bring back information to this group as well as to the VALA members on how this would apply to assisted living communities.
Right. I think if we go to like the VIIS or and you know, maybe allow us to use our assisted living license number or something like that, that maybe we could try that way.
It's okay. I can get back with Judy on this information, and she can send it out.
Okay, thank you.
Thank you for sharing that as a potential item to improve. Any other questions or comments before we move on to our last topic of the webinar? I do see a hand raised from Ann Temple. Ann, can you hear me? You are unmuted. You might need to unmute from your end as well.
Is it everything okay now?
I do hear you now.
All right. On the flu vaccines, we've been getting some kind of mixed things, like everybody's putting up like we need to get them now. Is there some update? Because we usually give ours both the last of September and the middle of October. Is there been some update that we should do it sooner than what we've been doing? We sent our list to all our physicians that take care of their residents here, and they're saying they haven't gotten the flu vaccine yet. So we kind of jumped the gun on them, but you know, at least we're in place ready to go when they do get it. But has there been some update that we should do it sooner?
No. September and October are optimal times to administer the vaccine. It's one of those unfortunate situations where we can't control everything. So if you have X amount of patients that would take you X amount of time to vaccinate, and you start at X day, would it take you 3 months to do it? If that's the case, you should start earlier.
Oh, no.
That's kind of more the idea of, you know, your patient population, how many you have, and when you're doing it. September and October are a great time to get it done. And we always like to remind people that you know, you need 2 weeks to develop immunity after getting vaccinated for flu. So oftentimes, you know, the myth is, oh, I got vaccinated and I got the flu because I got sick 3 days afterwards. Well, it's because you probably picked it up somewhere after getting vaccinated that you hadn't developed the immunity yet, because you need 2 weeks to develop it. So we always like to, you know, warn people that, you know, if you get vaccinated at the end of October and the virus is already circulating pretty well by the beginning of November, that is that risk. But September and October are really good, are good times to get people vaccinated. It kind of gets you ahead of when the virus starts circulating.
We started years ago because that NPI number was a problem, even with the flu shots and things. And I have a small population of about 45. So that is a small, and each one of mine have their own physicians that's right here near our neighborhood. So we send it over, and he sends one of his nurses over to do his own injections, and they charge it at the doctor's office. And they've been very willing to do that so we could get that paid for and the resident wouldn't have that cost to them. So I'm hoping, in talking to Dr. Anderson, I'm hoping we can do the same thing with the injection with the COVID-19. But I guess that'll all have to see as we're getting, you know, we're working on it now, talking about it. But I guess we'll see as it's distributed out, how it's distributed and who gets it first and all.
That's a great question.
And that's really good. Yeah, that's really good feedback, and especially providing back to VDH and us learning how these facilities vaccinate their populations. You know, it's really helpful for us for planning.
Well, that's worked for us, and we haven't had to worry about the charge, because one year we tried to do it ourselves and go through the pharmacy. We could get the medicine, but then when you get down to trying to charge for it, you can't get the money back for the resident. And I don't like the cost. I have to go to them when their Medicare would pay for a lot of these things, and we don't have the numbers to be able to charge for it. So our physicians have been very welcome to open up to help us get it done, even to the point like we had to carry them over in a car and they come to the car and just give it to them. So it might be a special talk. They might, you know, anybody might can talk with their physicians in their area and they'll work with them. So, but anyway, that's just something that we have done here.
Thank you, Anne, for those comments, and Christy, thank you for the updates, and we'll look forward to getting the additional updates in order to share that out. We are running a little bit low on time, so I want to get to our last topic of the day and welcome Bill Lessard with us from the DMAS. And so he is going to be talking to us about funding opportunities for assisted living communities. Thank you.
Okay, thank you, Judy. I assume you can hear me?
Yes, I can. Thank you.
Okay. You may have heard previously from my colleague Thomas Gates about the program that for both nursing facilities and assisted living facilities that will provide funding to cover COVID-19 costs, in this case assisted living facilities, for the months of July, August, September, and October. We had been planning this for a month to month and a half, and we kicked it off last Tuesday with an email to those on the email list for the assisted living that we got from the Virginia Department of Social Services. If anyone was not on that email and does not know about this from some other source, we can discuss where you can get that information, because every licensed assisted living facility in the state is eligible to invoice for this funding. So last Tuesday, we sent out the email, and it provided a link to 3 different documents. The first one was a welcome letter describing at a high level the program. The second document was an enrollment form and instructions for that enrollment form, because in order for us to pay you, for the Department of Medical Assistance Services to pay you, we have to enroll you in our system so that we can send out funds. And that was associated with a specific enrollment email address. And then the third item was an invoice workbook with instructions for assisted living facilities. We have, the department has contracted with Meyer Stauffer, MSLC, to administer this program on our behalf. And so they have put together this invoice workbook with instructions. They are an experienced accounting and cost reporting firm that the agency uses for nursing facility and hospital cost reports. And so they have adapted their experience for this very targeted purpose. Well, I do want to emphasize that this is not a Medicaid program. This is a program funded by CARES Act funds that have been allocated to the state, and this is one of the purposes that the state has chosen to go forward with. The state has asked DMAS, the department, to administer this because of our experience with providers and with this kind of invoicing and payment system. So there's a workbook with instructions. In the letter, we have suggested dates for sending in your invoices for each of the months, July, August, September, and October. But those are only recommendations. If it takes you longer to complete an invoice, you may send it in whenever you have completed it. We have received, as of this weekend, 138 invoices from assisted living facilities, and we are working to review them and then approve payments that'll be made through DMAS. And we are anticipating payments would be made, the first payments would be made on September 25th. And then after that, we'd follow up approximately every 2 weeks with additional payments for new invoices that we've received and have processed. If we approve the total payment, you will receive a letter to that effect. And then if we make any adjustments to that payment, the letter that says what the payment will be also does provide appeal rights if you feel like we have made a mistake. That is really what all I have here. The slide here really refers you to the DMAS webpage, dmas.virginia.gov. At the top of that page, there's a COVID-19 header. And if you hit that header and then scroll further down, you will come to these links that they have, that VALA has listed here. I'm happy to answer any questions.
Any questions or comments on the funding opportunities? And the links to all 3 of these documents are also on the VALA Health Alert page, and that you can download them. And also there's information on the DSS website from where they put out guidance referencing that the funding was available, as well as the DMAS website. I do see a comment that many ALFs spent significant funds early in the pandemic. Is there a reason that funding reimbursement isn't until July 1, 2020?
That's a decision that was made by the administration, and I can't really reply to that other than their decision was to provide funding through beginning in July.
That is an element that VALA is advocating for, to see if we can get that changed. But as of right now, all of the funding eligibility start date is July 1. You are welcome to also advocate, and you can look at previous VALA emails if you want for ways on the advocacy, or contact me. Again, I'm Judy Hackler, and I'll be glad to talk with you offline on some of those advocacy efforts. Any other questions or comments on the funding? I did include on today's webinar just some of the old slides from the August 10th webinar with regards to how the funding can be used, as well as some of the allocation amounts that was approved, that was shared from DMAS on the last webinar as well. So these will be included in the handouts that when you receive the slides. I do see a question about, are there DMAS members available to help providers navigate the process?
If you have questions and are concerned about the invoice process or the enrollment process, please contact the email address on the welcome letter. I don't know that off the top of my head, but we can share that. It is on the welcome letter. Please address any questions to that email address, and we will get back to you.
Any other questions or comments on funding or on any of the other elements? We have just time for maybe a couple questions, and then we'll have to conclude today's webinar. So again, if you're on the telephone and have a question, you can do *6 to unmute your line. You may also, if you're on the computer, raise your hand or use the chat function.
Okay, I've been able to look this up. The email address, if you have any questions, is CARES Act invoicing, all one word, _ ALF at mslp.com.
And what we can do is update the slides before sending them out to include that email as well, should anybody have questions. Any other questions or comments about the COVID response for ALFs here in Virginia? I do not see any, but I do want to thank you all for participating today. Truly appreciate you being here and working with us in a partnership in order to get the information and to figure out how everything should work to be able to best provide for the residents and for your staff. There will be an evaluation sent to you after this webinar concludes, and we will be providing the CEUs to those that participated on the live webinar that were pre-registered. We will also upload to NAB those that have provided us with their NAB registration number that begins with an R. So if you did not provide that at the beginning of your registration, you may also send that to us. If you have any other questions or anything that we can assist you with at VALA, on the screen is my contact information. Again, I am Judy Hackler, and you may reach out to us, and you may also access a lot of the resources that were shared on the VALA Health Alert page. So thank you all for joining us, and we will keep you updated as information is developed and presented. Thank you.